Observe the position of the hands in motion to see if movements are smooth and natural. When fingers are relaxed, they should be slightly flexed. Inspect the patient's wrists and hands, noting any swelling over the joints, as well as any deformities or angulation. Observe the contours of the palm, namely the thenar and hypothenar eminences. Note any thickening of the tendons or fingers. Palpate the distal radius and ulna on the lateral and medial surfaces of the wrist. Palpate the radial styloid bone and the anatomical snuff box, a hollowed depression just distal to the radial styloid process. Pain when palpating the snuff box suggests a scaphoid fracture. Palpate over the 8 carpal bones lying distal to the wrist joint, and then each metacarpophalangeal joint. Compress the MCP joints by squeezing the hand from each side between the thumb and fingers. Note any tenderness, swelling, or bogginess. Now palpate the medial and lateral aspects of each of the proximal interphalangeal joints between the thumb and index finger, noting any swelling, bogginess, bony enlargement, or tenderness. Bony nodules at the PIP joints, or Bouchard's nodes, are common in osteoarthritis. They are benign. Using the same techniques, examine the DIP joints. Benign bony nodules at the DIP joints, or Heberden's nodes, are also common in osteoarthritis. Repeat on the other hand. To check range of motion of the wrists and hands, begin with flexion and extension.
Okay.
So turn your hands palms up, and then just bring the fingers up toward your face. Good. Palms flat.
Okay.
And down toward your toes.
Continue to assess range of wrist movement with adduction and abduction.
With your palm down, bring your wrist into flat position and turn it away and towards you. Very good.
If there are complaints of wrist pain suggesting carpal tunnel syndrome, test sensation by assessing the median nerve in the pulp of the index finger, the ulnar nerve in the pulp of the 5th finger, and the radial nerve in the dorsal web space of the thumb and index finger. Other tests include hand grip strength.
We're going to check the strength of your fingers, your hand grip. Squeeze as hard as you can. Okay, very good.
Loss of grip strength is seen in de Quervain's tenosynovitis, or inflammation of the thumb extensor tendon, arthritis, and cervical radiculopathy.
Let's check out your wrist pain. Grab your thumb in your palm and squeeze hard. Turn in this way a little bit.
Make note of any wrist pain with extension of the wrist toward the midline in ulnar deviation or a positive Finkelstein's test for de Quervain's tenosynovitis.
Any problems?
No.
Let's check your thumb, your range of motion.
Perform tests for carpal tunnel syndrome, first using thumb abduction.
So I want you to just lift your thumb out like that and go ahead. Any problems there?
No.
Now Tinel's sign for median nerve compression.
Any pain in your 2nd, 3rd, or 4th fingers?
No.
Or tingling?
No.
What I'd like you to do is put the backs of your 2 hands together.
And Phelan's sign for median nerve compression.
If there's a problem, you should again feel tingling in your 2nd, 3rd, and 4th fingers. Any problem?